My matter tonight is for the Minister for Health, and the action that I seek is a review of the changes to non-emergency patient transport, which is denying patients in genuine need of pre- and post-medical treatment transport. Now, I acknowledge that there was a need to crack down on misuse under this program, but the changes that have been made are genuinely leaving patients who require support without it. And the government will quite rightly say that those decisions are matters for the clinics and the specialists, and that is true. But it is clear that there are now a number that are too scared to approve travel, because if it is left unapproved, they are then left with the bill. And they clearly need a little bit more comfort that essential trips will be covered. One example that we've had is patients going, or multiple examples of patients who are having to travel to Melbourne from East Gippsland for critical eye treatments to see specialists that often involve injections and impair eyesight. They are then not able to get a lift home because their travel's not being approved. They can't travel on public transport either. They are the very people who should be approved for non-emergency patient transport. Some have even cancelled their eye appointments because they couldn't be guaranteed the journey back home after that treatment. And when you need 12-week appointments for your injections, it can be the difference longer term between maintaining and losing sight. Post-operative patients have also faced a similar situation. One heart surgery patient was discharged from Monash and put on the train, which they found very deeply distressing, and brought that into my office. So my request of the Minister is to reconsider, I guess, some of the criteria here to give the clinics a little bit of comfort that if they genuinely book for those in need, they won't be left with the bill. And that will provide some comfort to those in my electorate, and I'm sure many other electorates around the state, that those patients can get the transport they need to get to critical appointments.
The member for East Gippsland raised a matter for my attention, Speaker, in relation to non-emergency patient transport. And I'm happy to advise the member that there have been no changes to the eligibility criteria for NEPT, and that is that there is a clinical need, or there is a need for clinical observation of the person being transported. But I'm very happy to come back to the member in relation to what other community transport options may be available. And I recognise the issues that he's raised with me this evening, and I will provide some further information to him.